Bye guys, have a good weekend. Thank you. Hi, Mrs. Lee, how are you?
Good, how are you?
Not too bad. We are just in the middle of changing classes because we have a surprise for the kids this afternoon. So I'm just gonna get them in here and get them going on a few things, and then we'll be back to start our interview in about probably 5 minutes or so. So
Okay, no problem.
I'll be back in just a few minutes.
Awesome, thanks.
Morning, guys. Good morning. We got a couple things to take care of real quick. Yeah, what did he say?
He's gonna tell me a little bit about it tonight because
Okay.
I asked him about it.
You think about it? Okay, sounds
He
good.
really doesn't do it.
And tell him that it'll be on Zoom, so he could actually do it probably about, well, usually like at certain class times and stuff, but we can make it work. So. Okay, okay, sounds good. Okay, hey guys, we're gonna get rolling pretty quick today because we have a guest speaker today. So right now, let's go ahead and take care of your payday today. So your yellow and blue sheets, come on out. Anybody that's absent that needs to pay a bill, please make sure you do that. We're getting yellow and blue sheets out. Very quick announcements today. So quarter does end today, guys. Any missing worker classes must be turned in today. And then we are just 5 days away from starting spring break. So a lot of things going on between now and next Friday, including our special schedule today. So I don't know if we'll have time to clean out binders today, but I did go ahead and post up here the items that we do want you to keep in your binders. So it's pretty much all the things that you've done for Net, plus your theme for your retest next week for somebody that's doing that, and your checks. So if you get a chance later today, when things out, you can. So, all right, on your checking and savings accounts today, if you check your white sheet with your bills, you do get paid today. $400 should go into your checking account. This is the full use sheet. And if you look back at your previous payday, that's exactly how you're going to do it today. So the day is the 19th. And you'll write down paycheck. This is your blue sheet. Make sure you have the blue sheet. $400 for paycheck. Obviously, do a little math there. I think for you guys, it should be up to, I think, a total of $506. Okay. Make sure you mark that down. Right, and then $50 goes in your savings account, in your yellow sheets. Thankfully, you haven't had to take anything out of that, so we'll see what the price is next week for you. Yep, with the deposit column. We'll see. We got a couple of bad good price. Yeah, it's got a little low on your account this week, so. Yeah. So 50 right here, and then should have 100. All right, so updated total for your savings account should be $100. You got that, Mark? We are going to do March Novel Madness voting on the annual class today. We are for our interview. So if you can remind Mrs. Broad, you guys know, well, maybe about like 10:06, 7, something like that. Remind me to do that real quick, and then we should be in good shape. Anybody have any questions for me before you go in today? Good. Okay, well, Mrs. Lee is here today to talk to us about the medical profession. So let me get her pulled back up on the screen so you guys can see her. there we go. So, all right. We're good to go? Okay, sounds good. All right. So thanks again for coming, Mrs. Lee. We really appreciate it. Sorry that we couldn't have you in person this year, but we certainly are excited to talk to several people that are in different professions and kind of get their thoughts on things. And so this morning we actually did a talk with a college speaker from the area. And so now we're going to talk with a guest speaker, it's a career speaker and stuff. So I would say just go ahead and start by kind of introducing yourself and your background in the medical field and how you decided to go into this, and then the kids have some questions for you, and then I also have some questions that I'll probably put in there as well. So
Perfect. Well, good morning, everyone. For those of you that don't know, my name is Cora Lee. I'm Maddie's mom. So, hopefully Maddie is a decent enough student there at Elmwood, and appreciate you guys having me today. So, so I've been a nurse going on 21 years. That was like way before any of you were born. I decided I wanted to do the medical field probably back in 7th or 8th grade. We did similar thing as a career day. I always thought I wanted to be a pediatrician or a doctor who took care of kids. And then I wanted to do physical therapy. And then by the time I decided to go to college, I decided to do nursing. So I got my degree at BGSU, go Falcons, and graduated there in 2000. My first job in nursing was working with cancer patients. So I would administer chemotherapy and try to help those cancer patients. While doing that, honestly, I loved when a patient was really sick. It really made my brain work, and I always wanted to help them. That then led me into emergency medicine. I worked at Wood County Hospital in the emergency room for 16 years, holding different positions. Also, I worked at the emergency room up in Perrysburg, for any of you that may know the Mercy Hospital that just got built probably about 7 years ago. In that time, I also worked for Life Flights. So if you see the helicopters going by, the big ambulances, I was in those units taking care of patients. I also did a little teaching for nursing students, and I worked at BGSU. So definitely a wide variety of different areas in nursing, which is probably why I love nursing so much. The great thing is if you start in one area and you get bored or you don't like it, you don't have to get more schooling to go to a different area. You can just get a different job, and it's hands-on training, and it's just a great variety. The other thing I love about nursing, it allows me to be active with my family. So I'm able to go to the events, go to see basketball games, volleyball games, musicals, those type of things. So it allows me kind of that availability to do that. 3 years ago, I decided I was done working emergency medicine, and my motto was work smarter, not harder. So I actually went back to school and got my master's degree, and now I'm a nurse practitioner. Started working urgent care, and now I work with sleep. So here's my little poke to you guys: get off your devices an hour before bed because you'll sleep better. All right. But I love taking care of people. I love seeing people smile, when they have someone who sits down and listens to them. Even in taking care of cancer patients, I still have great memories with that, of holding hands and seeing people go through those troubling times, and sometimes just a handheld, though we can't do it during COVID right now, makes all the difference in the world. And so I definitely have nothing but wonderful things to say about the medical field. Obviously, I can speak to nursing more than anything, but yeah, so that's where I'm at now.
Yeah, that's a really good introduction there. So, yeah, and obviously very different working, as a nurse practitioner than the emergency field. I'm sure you saw a lot of very interesting things happen in that area. So, yeah, might have time for story time later if you want to share anything. So,
no problem.
What does a typical work day look like for you, Mrs. Lee?
So when I did nursing, when I worked the floor, usually it was a 12-hour day shift. They can be very long, but the wonderful thing about 12 hours, you work 3 days a week, which is fantastic, because then you have 4 days off unless you want to pick up extra. But, it varies from area to area. Obviously when I worked the floor, there was very much a routine. In the morning I'd assess a patient, then we would do baths, and then I would do med passes, and then just take care of that patient throughout the day. Emergency medicine, chaos. I mean, 12 hours of chaos. And honestly, I loved it. It could be someone coming in with a sore throat, someone coming in with a broken ankle, all the way to someone coming in who is not breathing or is having a heart attack. And the adrenaline rush with the emergency room was always a fun thing for me. It was exhausting after 12 days, especially when you had those emergencies. But, and then the other thing is too, I did work night shift. So there's a big difference between day shift and night shift. A lot of people don't want to go into nursing because they don't want to do night shift. Oh my gosh, I love night shift. Night shift was a great time. You could just relax. You could have fun with your coworkers. And honestly, I started working nights after I had Maddie. So I had little babies and I was sleeping during the day. I would sleep when they slept. But it makes it work for you. But I can tell you in all of my nursing fields, it's never boring. Day goes very fast. And by the time you hit 12 hours, like, whoo, I can't believe that was 12 hours. Now that I'm a nurse practitioner, it's a little bit nicer on my body. I work 8 to 4. It's an office job, and we're doing a lot of Zoom appointments like we're doing today. But we're starting to see patients back into the office. So it's more of a laid back job.
Yeah, I bet. As I say, that'd be definitely a big switch between the two. What made you decide to go back to being a nurse, or I should say, decide to switch to the nurse practitioner? What was the big change there?
So I would say probably about 10 years ago, I entertained the idea. I thought I wanted to do family practice. A lot of it was I was tired of working 12-hour shifts because they are long days. And the other thing is too, let me back up with being a nurse. It's not uncommon. You are working weekends, you are working holidays. My kids experienced for the first time literally last year, my oldest is 18. I was off Christmas Eve and Christmas Day. It's the first time in 18 years I've actually been off those days. But here's the bonus with working a holiday, you get more money because usually they give you double time. So that's double your pay. But really what kind of made me finally make the decision, in all honesty, a friend of mine asked me to do it. She's like, hey, you want to go back to school? And I'm like, all right. I didn't know if that's what I wanted to do. And so I said, oh, let's see if I get in. Well, of course, about every grad program, they want your money, so they'll accept you into their program. But it actually ended up being probably one of the best decisions. I mean, I now have the autonomy, so I can do things on my own. I don't need a doctor telling me what to do. I am the doctor. Without having the responsibility, without having the financial debt of going to med school, I get to make these decisions. And you're starting to see the wave of medicine going to nurse practitioners. Your family doctor, probably a lot of you guys out there, your family doctor, you're probably seeing a nurse practitioner more than you're seeing a doctor. That's just kind of the wave of the future.
Yeah. And definitely, certainly things are changing in medicine a lot with the pandemic now and those kind of
Absolutely.
things. And actually the kids that asked some questions yesterday, how has your job changed since the pandemic has started?
So as a nurse practitioner, like I said, we're doing a lot of Zoom appointments. So, same with you guys doing when you have online learning. Same thing, I'm talking to people over a computer, which the downfall is I'm not making those connections. It's very difficult to, have that conversation because you can't read a person as well over a computer as you can sitting in a room with them. The other thing is too, you see my stethoscope, I can't use it on a computer. So it's really going off of just what the patient's telling me to appropriately treat them. And typically, I mean, once you've been doing this long enough, people tend to say the same thing. So you know what they're talking about and you can treat them as such. But there's still those times where laying on hands is really important in medicine. Using all of your senses is important to do that.
Yeah, for sure. So yeah, and that's certainly something we've had to adjust to throughout the pandemic, is just not having that personal experience quite as much.
Absolutely.
So yeah, that would be really tough there for sure. So okay, well, I'm gonna pause and see, do we have some questions so far, guys, that you want to ask? I have some questions from the bucket yesterday too. So questions so far from Mrs. Lee? Okay, they're being a little shy, so we'll get them worked up here a little bit. Okay, so here's some questions from the bucket yesterday, and then I've got some other questions I'll ask you too. But so one that was actually put in the bucket quite a bit yesterday was the needles and blood. People don't like the needles and blood very much, and so they're wondering, was that an adjustment for you? Were you always okay with some of those things, or actually one person even asked yesterday, would you still consider going into the medical profession if you're scared of those things?
So what I will tell you, let me answer the last part of that question. A lot of people, my husband included, he hates needles, hates them, but he doesn't mind when other people are getting them. He just doesn't like them on himself. So, definitely if you have any kind of fear of blood or needles, don't knock the medical profession out totally. It could just be that, again, it's on you, that you have a problem with it, not on yourself. For me, I love starting IVs. That is probably the biggest thing I miss from going to a nurse practitioner, is now I give the order to do the IV when I want to do the IV. And sometimes when I work urgent care, if we need to do an IV, I don't let the nurses do it, because I just love doing that. Since I started in oncology, I worked with people who their veins were horrible from doing chemotherapy. So, pat on my back, I was very good at starting IVs. So, transition to nurse practitioner when doing urgent care. Now I do suturing. And so stitching people's skin. Now I cannot stitch fabric to save my life, but I can stitch skin, and I do a pretty nice job and not leave a scar. So, the needles, actually, it's a fun thing to do. Especially when you get good at it. And what's even a best compliment is when the patient comes in and they request you. They're like, hey, is Cora here because she got my IV the last time? And that's just a nice pat on the back for you.
Yeah, I'd say that's really nice to have people that want to come back and see you and
Yes.
stuff. So, yeah. And actually that kind of leads into my next question that the kids put in the bucket. And you talked very much about how you're very passionate about your job. And so one of the questions was, what is it like for you to be able to help people every single day? What's the reward in that for you?
Oh my gosh, there's nothing better than having someone say, and I had it yesterday, I had a patient say, thank you for listening. And honestly, I didn't have an answer for him. And I told him flat out, I don't know what's wrong with you. But they just love being able to listen. And, my favorite stories go back to, the emergency room when we had a patient pass away, comforting that family. That was a great honor. And I would always tell the patient, it was an honor for me to be in here during this horrible time. Same with oncology. It was just, it's always an honor to be a part of that. One of my favorite memories from oncology, and kind of going back to working Christmas, we had a woman who in her 40s dying of cancer, and she had small kids. The kids spent the night Christmas Eve, and on night shift, what we did is we brought presents in. So we, kind of acted as that, the big guy and the North Pole, that spirit of Christmas. And the kids woke up to presents that we purchased for the kids. And, that's an experience you will never forget. And I had patients when I was pregnant with my girls. I had a patient's wife make me a baby blanket. I have it to this day. It's just such a rewarding career. And, in this day and age, we hear all the negative, this job is, this person's horrible in their job or whatever. And when you get those compliments, there's nothing like it. And that's
Absolutely.
why I keep doing this job. When you get to the point of your job, and regardless of what career you pick, when you become that refrigerator job, meaning you're making payments on your refrigerator, you're just there clocking, putting your time in. If it's not a passion, you need to get out of it, because life's too short. You need to always do something that you love doing.
Yeah, I agree. Absolutely. So yeah, it's nice to wake up every day and be happy to go to work and enjoy what you do and stuff. So I would definitely echo that comment as well. Another thing that I was thinking about while you were talking there is, obviously COVID's changed quite a few things. And one thing we've been talking about as we started our career exploration is looking at the job market and what the job market's going to be looking for them when they graduate here in about 4 to 5 years. And the medical field, obviously we see a lot of things happening with the medical field. What are some things that you see opening up in the medical field here in the next couple of years, or some things that you predict will probably happen with the job markets now that COVID has happened?
Well, first of all, there is never a job shortage in the medical field, especially with as people age and the aging, that lifespan is going longer. We have more people in the population, which means we have more jobs. So, the medical field is always job security, no matter where you go. I predict what we're doing right now, telemedicine. This is good. This is not going away. And there are some people, especially the older nurses, the older doctors, they don't like telemedicine. So they're going to need people who are very good at doing this. And especially you guys, you grew up with devices, you've adapted so well to online learning that this is not going to be a problem for you. And so I think that's going to make you more marketable because you're going to know how to do this. I had a learning curve with this is honestly the first Zoom meeting I have not initiated. So it was great for me to see what my patient sees as they're waiting for me to let them in my meeting. And so I anticipate that this is going to be huge, which in turn, especially not so much here in, Northwest Ohio, but if you go out west, your Wyomings and your very, very rural areas, this is going to be a game changer for those patients that they're going to be able to get even, I think, better care.
Yeah, for sure. So yeah, it's kind of funny to think about it, but I mean, really, if you think about it, guys, like you guys probably are a little bit of a step up with your generation because you will have the technology to do these things in your jobs. So that was a really good comment. I guess I haven't thought that through, but that'll be really good for them there in the future. So questions that you're thinking of so far? It must be Friday morning. So yeah. Okay. Well, a couple of the kids did ask, and so I'll see if you want to share some of these stories and stuff. So a lot of them are curious about some of the things that have happened to you in your profession. Some have even asked if there was some disgusting things that happened to you in your profession and stuff. But yeah, so maybe just some stories of, I mean, obviously since you worked in the emergency department for so many years and stuff, maybe some stories of some really big cases that came in or some things that really changed your perspective or just anything that you think they might enjoy. So
all right, so let me preface this by, does anyone have any problems talking about blood or bodily fluids or anything like that?
Does anybody like pass out if we talk about it or anything like that? Natalie gets a little shaky. Okay. Maybe not too many details on blood. Okay. We have a couple of iffies, but yeah, go ahead.
Okay. So what I can say is, especially working in Bowling Green, the worst time to work is tractor pull and student move-in. And
they're nodding.
We always have a board and we mark tractor pull, student move-in. As patients come in, we keep a tally to see how many we see from each. So one of my most favorite stories is working that weekend, and it never failed. It always seemed to fall on my weekend. Tractor pull weekend, we get a call from an ambulance that said, we're bringing a gentleman in from the tractor pull who has a nose injury. Okay, no big deal. Guy comes in and he's holding his nose. So we're like, what happened? And one of the tractors blew up and sent parts into the stance. And he got cut by one of the parts. Like, wow. Oh, okay. I take it away. He has no nose. It took the nose.
Oh my gosh.
So, I mean, now for me, I'm like, that's really cool. Can I get someone else to show this? We're playing show and tell with us. We ended up, we shipped the guy up to St. V's. He went into surgery. They were able to put his nose back on, and no joke, the guy was there the next day at the tractor pull because he was here from Wisconsin and he paid a lot of money to be at the tractor pulls. And so that was really kind of one of my cooler stories. My disgusting stories, they always deal with drunk students, drunk college kids. And you could even ask my girls, that's half the reason I got off a night shift. The one thing that I would do with my drunk college kids, because it never fails, they fall asleep. So here's a warning. If you decide to be dumb when you're in high school or college and you drink too much, don't be surprised if you show up in my ER. I'm going to put you in a diaper when you pass out. So when you wake up, you're waking up to a diaper because I'm not cleaning up your pee.
Hey, so, that's a great life lesson right there. Yep. I like that. Yeah. Wow. Geez, that tractor pull story. Wow, that's crazy.
Like I said, that was pretty awesome.
Yeah. So yeah, just a second. We have somebody's comment real quick here.
Yeah.
I'm substitute teaching today, and my name is Beth Nagel. And my husband works at Wood County Hospital in ICU.
Oh, Ron.
Yeah, see, she knows. She's worked with him for years. But here's the kicker. I used to work for Northwestern Ohio Tractor Pullers, and I coordinated that national tractor pull. I was working the year that that happened when the tractor exploded. So
See, so
I
you
can
just.
relate to a lot of the stuff that she's telling you. Plus, she's worked with my husband, the nurse. He works in ICU, and he can also tell you about those students that have come in on weekends that end up from the emergency room up to ICU.
Yes,
Yeah.
the nice
You don't want to be
thing,
one of those students.
the nice thing about the difference between an ER and an ICU, I just treat them and I street them, and Ron has to deal with them. So.
And
What is it
other
better?
than per code laws, he can never tell me anything about his patients.
Mhm.
He comes home from night or days and he goes straight to the barn and works with the horses. That's his stress release. But he will say, I had a bad day, I had a good day, or I had students, suicide students,
Mhm.
had drug students, I had. He will never tell me who you are, or even if it's male or female usually.
Yeah.
But he gets them.
Yeah. So yeah, a lot of crazy stories and stuff. And my mom has been, I think the kids probably know this, I've shared it before. My mother's been in nursing for 40 plus years. And so, yeah, I've definitely heard a lot of stories as well and stuff. So yeah, it's been, yeah, very interesting to see and stuff. So yeah. So questions that you're thinking of so far, guys? Okay, they're starting to get really interested now with the whole nose story. Okay, so let me go on to the next part. I want to take one more of the kids' questions that they put in the bucket. We talked about how your job, you're very passionate about it, and the things that you do appreciate about your job. What do you find to be the most difficult parts of your job?
The most difficult parts go back to, my oncology, my ER, people who are dying, young people. I always said, especially when I started oncology, when I started to question God, I needed to get out. When I saw 40-year-olds, and now that I'm 42, it hits even harder now that I took care of those patients. Those are hard. The other ones, those kids that I've had several kids that come in as child abuse cases, and that breaks my heart. And having to find a way to help them and try to, you want to keep them with their family if at all possible, but if it's not a good situation, it's how do you deal with that? Anytime, anything dealing with a kid, I've had several kids die that I've taken care of. That's hard. My one of my hardest stories I will never forget. We had a call come in. It was a 18-month-old not breathing, and I always had my bargaining with God. This is not a person. This is a diagnosis, and I need to think of this as a diagnosis so I don't get emotionally involved. So patient came in. I did my thing. Start my IV. We're doing compressions, breathing, and I heard the grandfather. And I knew the grandfather's voice. And to this day, I'm probably going to tear up. I remember looking up at God and saying, we had a deal. And baby ended up passing away and comforting them. But what was the hardest thing was the coroner said only I could take the baby to the morgue. He said, this is a coroner's case. We have to investigate. We can't let mom and dad take this baby. So here I do. I wrap this baby up and I walk the baby to the morgue. It was the worst day of my life. And it made me appreciate what I have at home. That not everyone is as lucky, even on those days where you are so mad at mom and dad because they took your phone away, they yelled at you about cleaning your room, pick up your socks. I had these conversations daily. You get to have those conversations. And that's kind of always the key that I took away from it is, you talked about Ron going out to taking care of the horses. There is stress. And I think especially in medicine, they don't allow you to debrief. They don't allow you to just sit and talk, especially in ICU and ER, because you got to move on to the next patient. You don't have time to sit and think about what just happened. And so you have to find those healthy outlets to get rid of the stress. And, you go home and you hug your kids a little harder and you hug your husband a little harder. And, so there, it's definitely, it's 98% awesome. And then there's the 2% that is kind of cruddy, but
Yeah.
I would still take that over some other jobs where it's the reverse.
Yeah, absolutely. So yeah, and that's very truthful to share those stories and stuff, because yeah, I mean, we certainly learn from those things, and yeah, every job's going to have difficulties, and certainly that's one in the medical profession for as well. So speaking of, one thing we've been talking about is kind of related professions and stuff too. So I know some students had commented that they are definitely thinking about the medical profession, maybe not necessarily nursing, and wondered if maybe you could speak to some other medical professions that might be interesting for the kids to kind of investigate as well.
Yeah. So, the great thing when I worked in the hospital, I definitely got to know other medical professions, radiology, lab, and even IT. The hospital has tons of IT people. And I mean, they are, especially right now, we are all in a generation of electronic medical records. So you can even do medicine without doing medicine. So you can get involved with doing kind of the background part of it, doing the administration, doing the computer stuff. I always thought ultrasound would be a cool job. Most people think, oh, it's just sticking a probe to look at a baby. Well, that's just one ultrasound. I mean, they do ultrasounds for administering IV lines. They, ultrasound gallbladders, appendix. It's just really cool to kind of see all that. And same with radiology. I mean, when you can take a picture and get a 3D image of your spine, that's impressive. And that just helps the doctors know, especially if they have to do surgery, where they need to, go in and cut and all that stuff. I did explore and worked a little bit with teaching. So even though I did medicine, I actually taught nurses how to be nurses, which was really kind of cool. And I joke that I have a very high standard of care. And so those nurses, oncoming nurses, had to meet that standard, because I said, if I won't let you take care of my family, you're not taking care of somebody else. And so, just kind of taking that little bit of glimmer that they have, and just just exploring and festering with it and making it grow into great nurses, just like you guys are experiencing at school. These teachers see something in you, and they make it grow, and that you can still do that too in medicine.
Yeah, definitely. So, and actually that leads me to my next question too. And can you talk a little bit about, obviously, we're just finishing up 8th grade here in the next couple of weeks. And I know high school is coming around the corner here, guys. And one thing that we talk about is what they need, to go into these professions and stuff. What would be some things that you think would be really important for them to pay attention to in high school if they are considering a medical profession in the future?
So definitely the sciences are a big subject. And I will be the first to admit I hated chemistry. I didn't care for microbiology. I thought, what do I care about, what potassium does? And then when I got into nursing, it reverted back to college and high school. And I'm like, oh yeah, we talked about that. So, your sciences are a big thing. Your maths are a big subject area. I would say too, I have my older daughter's doing a lot of CCP classes. That might be even a way to kind of explore that avenue, just to kind of help with college. And here's where I'm going to probably get my plug in. Penna Career Center is a great resource. Their exercise science course is hands down one of the best courses you could take for your anatomy. My husband, he did athletic training in college. He knows way more about muscles and bones than I ever will know. And the kids that are leaving that program have that knowledge. And I wish I had that, because it would have made, especially a nurse practitioner job, so much easier to just have that knowledge. I have a broad knowledge of a lot of things, but just to have that specific knowledge, or even like med tech. The other thing too, especially if you're exploring the medical field, get involved with, become an STNA in high school, work in a nursing home, work at the hospital. They used to, I don't know if they do now with COVID, but they used to have the student nurses, which was a great way to explore. And I tell you what, you find a good nurse who you get to know. I let a lot of people do stuff just to get the experience, and when you're in nursing school, if you decide to pursue that, get involved with the hospital, because you will soar so higher in college by having real life experiences. And one thing I tell people too, if you're thinking even nurse practitioner, I would say a minimum 5 years of nursing experience, because having real world experience makes all the difference when talking with your patients, rather than going straight on to nurse practitioner, because patients are going to be like, well, why don't you know what I'm talking about? Well, if you haven't experienced it, it's hard to relate to the patient.
Yeah, absolutely. So, yeah. And, obviously, Mr. Lee works up at Penna Career Center, and actually he's going to be working on a video for us to show us kind of around Penna, because we're not able to take the field trip up there this year. So that's a really great suggestion, is looking into that, because anything hands-on, guys, that you guys want to do in the future, I mean, I highly recommend Penna, because I had students that, went on to vocational schools and stuff, and just the experience is just outstanding. So especially if you're a hands-on person, which, some of you are sitting here going like, maybe I don't want to sit through, 4 hours of classes every day and stuff. So, I mean, that's something that you can kind of consider to get some hands-on experience. So,
Well,
yeah.
and I can also tell you, which I just learned this, the exercise science class up there, you actually get an English credit and a science credit while you're taking that
Oh,
class.
that's great. That's awesome.
And they have a lot of classes like that. So again, for the kids who are like, I hate science, I hate English, I hate math, you're getting it into your program. And so you're kind of killing two birds with one stone. And the other thing is too, those jobs, they're not going anywhere. Those jobs
absolutely.
are secure jobs.
Yeah, that's a great point. Yeah, because I mean, the demand for those jobs are certainly going to stay. So that's for sure.
Absolutely.
Well, we're going to get things wrapped up here in just a couple of minutes. So questions that you've thought of for Mrs. Lee so far at all? I've got some from the bucket yet. So there we go. Now we're getting some people. So Allie, go ahead.
Can you mess up stitches?
Can you mess up stitches?
Oh yeah. Yeah, you can mess up. And honestly, how you know if you messed up stitches is if you have a nasty looking scar. And you can also get infection if you don't do them correctly. If you don't do them in a sterile environment, you can get infected and have to take antibiotics because of it. I was going to show you guys, that was going to be my hands-on thing, but I couldn't figure out how I can show it on the camera and still talk.
Yeah, no, that's just fine. So yeah, that was a good point though. Yeah, it's like there's definitely some boo-boos. So Allie, what else? How many years of schooling did you have to take?
So with nursing, it's great because you can get an associate's degree, which is 2 years. Usually, especially around here, you can go through Owens or some type of a community college. But then I did 4 years at BGSU because in all honesty, I didn't like school. And I figured if I'm going to do this, I'm going to do it one time and be done. And I swore I would never go back. And then I went back 3 years ago. So it's funny just how life changes. But, I'm kind of one that prepping for the future, I would recommend probably getting your bachelor's degree because they keep saying they're going to phase out licensed practical nurses, which is about an 18-month program. They haven't yet, but typically you see those more in the nursing home setting. And honestly, if you want to take care of old people, that's a great place to go. And that's another avenue. But I would think for you guys, especially looking into the future, education is only going to be increased. So I would recommend if you're thinking about doing it to do a 4-year program.
Okay. Yeah, very good. So other questions you're thinking of? No? Sure. Okay. All right. Well, we'll go ahead and start getting things wrapped up. So thank you so much, Mrs. Lee. I really appreciate you being able to do this today. And I mean, I thoroughly enjoyed listening to you about the medical profession. And I think that they will certainly be able to take some of those things into high school with them to certainly look in that professional more. So
awesome. Well, thanks for having me, guys.
Yeah, thanks so much. I really appreciate it. Have a wonderful weekend. And thanks again for doing this today.
You too. Thanks. Bye.
Take care.